All right, here we go. Good evening. I'm Dave Davis with News on 6.
And I'm Bobby Miller with News 9. Thank you so much for joining us for this virtual Medicare forum presented by Global Health.
The reason we're together this evening is we know many of you have questions related to Medicare, from who is eligible to sign up to how to navigate the system for a loved one.
Sorry, Dave, I was moving my light. Okay. As Oklahoma's own News 9 and News on 6, we are thrilled to be partnering with Global Health to bring you the answers you need from the experts. So let's take a few minutes now to make a roundtable of all of our panelists here. We'll go around our virtual roundtable of experts and let them introduce themselves, starting with Dr. Williams.
You want me to redo what we did just a little while ago?
If y'all already did it, we can roll past it, Dave.
Oh, perfect.
I can't. I'm sorry. I'm not trying.
No, you're fine. You know how to introduce yourself by now.
Yeah, so this will exactly what Dr. Williams said, everybody. This will be where we just say literally what we just said. I'm doing this. I'm with this company. This is what we specialize in. That was perfect. Okay, so there's the 4 introductions, and then here we go. Thanks so much to each of you for joining us tonight. We do want to get to as many of your questions, your viewer questions, as possible. So we've asked our panelists to limit the responses between 2 and 3 minutes. So let's get started.
Okay.
Megan, are we going to have some sort of white graphic music here, or do we just literally like jump into the ABCDs of Medicare question?
I'll have every theme that we go into of the questions will have a graphic that titles the theme.
And do we need to like wait for that? Because we won't hear it, right? Will we?
You won't hear it. If you kind of just want to verbalize it, here we go. Let's talk about the ABCs of Medicare, and I'll just put it up as you say that.
Okay.
Yeah.
Okay. Well, I guess, Bobby, since I kind of left off, do you want me to start with the first question and we just kind of alternate down from there?
Just go right ahead.
Perfect. Okay. So the ABCDs of Medicare. So this question is for Dr. Williams. What is Medicare and why was it created?
Medicare is a federal, I'm sorry for reading this right now because I'm not as prepared as I should be, but Medicare is a federal health insurance program for people who are 65 and older, who are citizens and permanent residents of the United States. Also, those under 65 who are disabled or have end-stage kidney disease can qualify for Medicare. Medicare was actually signed into law by President Johnson in 1965 to provide healthcare coverage and increased financial security for older Americans who may not have been well served in other employment-linked group coverage.
Okay, next up, we've got Mr. Weaver. We want to know, how does Medicare work?
Well, with Medicare, you do have options in how you get your coverage. There's really 2 main ways. That's original Medicare and or Medicare Advantage. Original Medicare pays for much, but not all of the cost for covered healthcare services and supplies. And Medicare Advantage is kind of an alternative to original Medicare. Most of these plans offer extra benefits that original Medicare doesn't offer, such as vision, hearing, dental, and several other types of things. Medicare Advantage plans have yearly contracts with Medicare, and they must follow Medicare's coverage rules.
Okay, the next question is for Eileen Bradshaw with Life Senior Services. Eileen, how is Medicare administered?
Like Dr. Williams said, it's a federal program. It's administered by the Centers for Medicaid and Medicare Services, so CMS. CMS also monitors Medicaid in all the various 50 states, and they all collapse under the Department of Health and Human Services. So there's lots of areas of oversight there.
Okay, good enough. And Mr. Potter, this one's for you. Does the patient have to pay for original Medicare coverage? And what about Medicare Advantage coverage?
Oh, you're muted.
My bad.
There you go.
Somebody mentioned this earlier. I do think it's important that we get the parts of Medicare question before this question, since this one references the parts, and that's a big part of the education, I think. So if we can make a note of that. So you usually don't have to pay a monthly premium for your Medicare Part A or hospital coverage if you or your spouse paid Medicare taxes for a certain amount of time. And that would be most Americans. And that's sometimes called premium-free Part A. You usually do pay a monthly premium for Part B, and Part B is where the coverage for physician services comes in. A beneficiary can also choose something called Part C, which is also known as Medicare Advantage, and there might be a monthly premium for Part C. There are lots of Medicare Advantage plans that offer their coverage with no premium at all to the member. That they're also, depending on the plan, there could be some member cost sharing for certain services and for some of their prescriptions. The best way to find out what is individually best is to talk with a licensed agent, and they will understand all of the different parts and all of the different premiums and help you pick a plan that's best for you or your family.
Excellent, thank you. And if, as a follow-up to that, Scott, Mr. Potter, what are some of the out-of-pocket costs that I might see with original Medicare or Medicare Advantage?
Sure. So you generally do pay a set amount in deductibles related to your Medicare coverage, original Medicare coverage, and then Medicare pays its share after you pay your share. Unfortunately, with original Medicare, there's no yearly limit for what those out-of-pocket costs are. So someone that has to have a lot of medical services during any individual year can run up a big bill. Medicare Advantage plans usually provide financial protection to you by setting an out-of-pocket maximum, and then that would be the most that the beneficiary would have to have and pay in that plan.
Okay, Scott, this one's also for you. Where does the money come from to pay for Medicare Advantage?
Okay, so Medicare Advantage comes, the money for it comes from two places. The first is that some of the money comes from the members, but most of the money comes from Medicare. So the private insurance companies that offer Medicare Advantage receive a payment each month from Medicare for taking care of the benefits for those members. That covers the cost of Medicare Parts A and B for each beneficiary. The amount of the payments from Medicare depends partly on the anticipated costs of healthcare in the country and where each beneficiary lives.
Okay, great. This next question is for Dr. Williams. Why have I not known about Medicare Advantage plans?
Good question. Unfortunately, Oklahoma's Medicare beneficiary population has half the adoption rate in Medicare Advantage plans compared to the national average. And hopefully by the end of this forum, this panel will have helped the viewers make informed decisions on their Medicare options.
Okay, and back to Scott then. Does Medicare approve Medicare Advantage plans?
Yes, absolutely. So Medicare has to approve the plan that any Medicare Advantage plan offers to beneficiaries. Then, as we said earlier, Medicare pays the health insurance provider, the private company, for taking care of the beneficiary. And one of the most important things is that Medicare really incentivizes those Medicare Advantage providers to work hard to help the individual achieve their best health.
Thank you so much, Mr. Potter. The next is for Ty Weaver. We're talking about the most important terms that I need to know walking into this. What are some of the most important Medicare terms? Because it just seems kind of overwhelming on the surface.
Yeah, there's a lot of them. A few of the ones that you want to pay attention to would be like co-insurance. For example, that's any amount that you may be required to pay as your share for the cost of services or prescription drugs. And co-insurance is usually a percentage, such as maybe 20%, 15%, something like that. Then we have co-payments that we see in a lot of Medicare Advantage type programs. And that's any amount that may be required for you to pay as share of a cost for a medical service or supply. Like a doctor's visit or a hospital outpatient visit or prescription drug. A co-payment is usually a set amount rather than a percentage. For example, you may pay $10 or $20 for a doctor's visit or prescription drug. Then we have cost sharing, which refers to the amounts that the member has to pay when services or drugs are received. For example, that would explain your your co-payment or co-insurance, I'd actually would like to omit that because it's a bit redundant on the cost sharing because it just explains the two things I just explained. Just FYI, I probably won't hit that when we're going through there. The next thing is deductible. This is a big one we get a lot of questions about. Yes.
Oh, I'm sorry. I was waving at someone down the hall. I haven't seen him in
Okay. I thought
months.
you were trying to stop. Okay. All right. So then we have the deductible, which is something that we get asked a lot when our agents are out in the field. And that's the amount that you must pay for your healthcare or prescriptions before your plan begins to pay anything. Okay. Also very important is your drug formulary. And that is a list of prescription drugs that are covered by your plans. The drugs on this list are usually selected by the plan with help from doctors and pharmacists. And the list includes both brand name and generic drugs. Maximum out of pocket, another very important term for Medicare Advantage plans, and that is the most that you could be out of pocket during a calendar year for in-network covered services. So that's your safety net. Then we talk about the network, which is a group of contracted doctors and physicians and hospitals and places that do accept your insurance coverage. Premiums, obviously we know what premiums mean. That's the periodic payment that you pay for different things in terms of Medicare or to the insurance company in order to maintain that coverage. And then the last thing is prior authorization. Prior authorization for certain services and drugs, you might need to get approval in advance from your health plan before obtaining those services or drugs. Your primary care physician or a specialist may submit prior authorization to the health plan for prior authorization to the health plan for prior authorization. If you do not get prior authorization, there are times when the health plan may not cover those services.
Okay, Ty, that was a lot. So we're going to give you a break now and go back to Dr. Williams for this next question. What are the different parts of Medicare? There seems to be several options and crossover.
For you, Scott, looking at this, are we going to push this forward or?
Yeah, I'd say we put it up. I'd say we put it up. What do you
Yeah,
think, Scott?
we'll
Right
move
off the
it
top?
Yes.
And that writes the most updated script?
I'm sorry?
Elizabeth, am I on the most updated script? I am.
Yes, ma'am, you are. We actually talked about that at the top of this meeting. Reading through the script, just kind of with a blind eye, I noticed that. And so I'm likely going to move it up after we introduce what Medicare is. And maybe the third or fourth question, I need to go back and look at where that might fit best along with Cynthia, but we'll definitely get to that before those questions that Scott was answering.
So you want to go on to enrollment?
Hey guys, I'm just an accountant, but I would suggest that what is currently question number 10 be one of the first questions, and that right after that should be question number 9. So we get all those definitional things out of the way because they're referenced a lot through the other questions that we're answering.
Scott, how much did you go through just a little? You went through this just a little while ago. Do you want me to, I mean, is it going to be redundant if I do the same? Or do you want me to?
I think we're good. We can move on to enrollment. I think that's what's next, right, Bobby?
Yep, that's right. And that's Ty again, if he's ready to talk again.
Okay, I'm ready.
How does someone enroll in Medicare?
Well, people who are receiving any type of Social Security benefits when they turn 65 will actually automatically be enrolled in Medicare and will receive their enrollment cards and information about 3 months before their 65th birthday. If they aren't automatically enrolled, they can sign up through their local Social Security office. They should enroll 2 to 3 months before they turn 65 to ensure prompt coverage.
Excellent. This next question is for Eileen Bradshaw. Talking about the enrollment periods, what are the different enrollment periods? And I wanted to throw this in there too. Because of COVID-19, have any of the enrollment periods been left open? Have you been able to change more because of the coronavirus? I kind of threw that in there, but I think that's probably important to talk about because I know with our company healthcare plan, I can change, my dependent care flex spending throughout the year freely. And I've never been able to do that because of COVID and people don't know if they're going to be in school. So I guess the thing I would say, Eileen, is just what are the different enrollment periods and has COVID changed any of that?
To my knowledge, they have not changed the enrollment period.
Okay.
If somebody else knows something different.
I won't ask that then if that's not.
Okay.
I just know with our private insurance, that's
it makes sense.
With it.
So, there are 3 different enrollment periods with Medicare, depending on your circumstances. The special enrollment period is when a beneficiary has what they call a qualifying event. So something has changed in their lives. Maybe you've moved. Maybe you have both Medicare and Medicaid. You're leaving your employer's insurance or insurance provided by your union, or your plan is discontinued. So the special enrollment period deals with those circumstances. The initial enrollment period is what we were just speaking about. When you turn 65, you get to enroll in Medicare. So there's about a 7-month window that can happen. 3 months prior to the month that you turn 65, the month of your birthday, and then 3 months after. So it's a window in which you can enroll, and it's important to try to make that happen on time. And then the annual enrollment period is a time where you can kind of reset. So if you enroll in Medicare and things are going along, and then maybe something changes, maybe there's a new medication or a new diagnosis, and you want to make sure that you're in the plan that best suits your current circumstances, the annual enrollment period will allow you to do this. It's usually between October the 15th and December 7th. It's a short window, but it allows you to enroll in or make changes to your current plan.
Okay, so that takes care of question number 3 then, that was up next. So I can skip that or just keep going. It says, why is that enrollment time important?
Yeah, that was a question that was important to Cynthia. They really want to talk about why that's so important. Okay. So yeah. I believe Dr. Williams is going to speak to that a little bit, because I think some people don't maybe have as much urgency as this group might like them to have.
Okay, so then she gave the dates, but Dr. Williams probably heard her say that. So Dr. Williams, why is this enrollment time important?
As Eileen stated, the annual enrollment period, or AEP, is from October 15th through December 7th, 2020. This is the short window of time that you can enroll or make changes in your current Medicare Advantage coverage. And it's important because once you make your changes, it becomes effective January 1st and goes till December 31st of the next year. This is important because beneficiaries cannot change plans outside of this time frame unless you qualify for the special enrollment period, as stated before.
Okay, let's go to Mr. Weaver. Thank you, Dr. Williams. How can I best compare my Medicare options?
Well, it's important to look at the full picture when comparing Medicare options, such as original Medicare, that's parts A and B, Medicare Advantage, which we call that part C, and sometimes it includes your part D, or standalone prescription drug coverage and Medicare supplement plans. There's the things to compare are if the following services can be covered by the plans, such as inpatient hospital stays, primary care physicians visits, outpatient visits, lab tests, x-rays, preventative exams, prescription drugs, and how to get drug coverage, what you pay each plan, including monthly premiums, deductibles, co-insurance, if there's maximum out-of-pocket protection, and will it pay for extra benefits such as vision, dental, over-the-counter items, and fitness benefits.
Okay, and then I'm just making sure now we're going to navigating Medicare options.
Mm-hmm.
Is that right? Okay. Okay, so it says Dr. Williams and Scott are going to share this. So what questions should I consider when selecting a Medicare Advantage plan?
Oh, please.
Hey, Wes, do you want me to go first, or do you want to go first?
Please do, because I didn't see my name on this.
Okay. All right. So probably some of the really big ones for folks are going to be around what they have to pay for things. So, first, how much does that monthly premium cost? Second, what are the deductibles for the medical services and drugs look like, especially for the services and drugs that you're going to use? What does it cost to see my doctor? What is the biggest cost that I could potentially have out of pocket? So those money ones are going to be really important.
I guess also of importance would be, is the plan located locally? And that's a big advantage with global health. It's a local plan with local employees and local phone numbers to ask questions. Scott already went through money.
The network is probably a big one that you could talk about, Doc.
And with the local plan, having the advantage of understanding the local physicians and who would be part of the health plans network would be a benefit. I'll get it right.
Okay, and you're up next, Dr. Williams, as well. Where can I learn about different Medicare Advantage plans offered where I live?
A good resource is Medicare.gov if you're internet savvy. It's a good place to find and compare plans. If I remember correctly, you can put plans right next to each other and run through the benefits that are offered with each plan. So it's an easy way to compare different MA plans. The other way and another good option is to use a local sales agent. They can set up an appointment with you over the phone, potentially, well, in the COVID era, meeting is not a good idea. Potentially set up a phone discussion and discuss your options through that resource.
Okay, and back to Scott now. Where can I get additional help understanding Medicare?
I would maybe throw out that I guess this is a little bit of a different question. I don't know if we seem like maybe we're going to be pressed for time. I don't know that this one is super consequential, but the Social Security Administration is a great resource. The federal government has a toll-free number that's 800-772-1213. And a website that provides basic information about Social Security benefits, Medicare eligibility, and a really important one, which is the Extra Help program for those folks that need help paying for their prescription drugs.
It says Ty, but Scott, do you want to keep going with the Extra Help program? That's the next question.
Ty will definitely be better at that than me. Yeah.
Excellent. So Ty, what is the Extra Help program? We heard Scott talk about it.
Sure. Well, the Extra Help program is a program that assists people who have limited incomes and resources. The program assists eligible individuals with paying for their Medicare prescription drug program costs like premiums, deductibles, and co-insurances. And according to Social Security, the average person that is on the Extra Help program saves around $5,000 a year in prescription drug costs. Many people on Medicare do not realize that they even qualify for the Extra Help for paying for their prescription drugs. And in order to qualify, you must have Medicare Part A and or B, and you must fall under certain income guidelines. If you think that you may qualify, you can definitely learn more and apply through Social Security or go to socialsecurity.gov.
And then we'll move on to this next section right here, navigating Medicare options. Okie doke. It says, Dr. Williams and Scott, you'll share this one again. What questions should I consider when selecting? No, I'm sorry. I went to the wrong section, didn't I? Oh.
Yeah, Medicare Assistance Program.
Stand by. There we go. Okay. So that is it Eileen?
Yes.
Okay, you ready? Here we go.
Right.
Is there a Medicare Assistance Program?
Yes, Life Senior Services offers a Medicare Assistance Program. We call it MAP. And we do it to help folks navigate all aspects of finding the right Medicare plan. Part D enrollment assistance, low-income subsidy assistance, and plan exploration. Our real goal is to help provide people the tools they need to evaluate the programs and find the one that's best for their particular needs. They then move forward with the advice and contact the insurance provider themselves. We are one of 7 agencies that contracts with the Oklahoma State Department of Insurance to provide these services.
And Eileen, we can continue on that. Why should I use MAP? What things should I consider?
You know, Medicare has a great plan finder online, so it is a wonderful tool. But for a lot of people, it's overwhelming. and just sitting down and getting through that and looking at all the choices, because the plan that's right for me this year may not be the plan that's right for me next year. And so there's a lot at stake. Money is important to all of us, and it can really result in a big savings. Last year, over 1,800 seniors came in and visited with us, and about 2/3 of them either enrolled in Medicare for the first time or switched plans because they saved money. I think the average savings was over $1,500 per person that switched. But I know personally a couple of people that saved over $50,000 because they were on kind of an exotic drug. And by finding the right Part D plan, it really made a huge difference in their lives. So it's always good to have a friend go through this with you, and just to check your options out, whether you do it with a Medicare assistance program or do it with MedFinder.
Okay, and we'll stick with you for this one too. What is MAP on the Move?
Well, transportation can be a barrier, right? We know that a lot of seniors, it's hard to get places. And so MAP on the Move is now going. We still will be doing in-person and phone appointments. We've got some COVID contactless ways to provide this assistance this year. But we're also going out to about 20 new locations where we can meet people in their neighborhoods. We're going to several parks. We're going to assisted living centers where people just don't have to travel so far, and we can serve people closer to home in a safe way.
And how do I contact MAP, Eileen?
Well, you can contact Life at 918-664-9000, Monday through Friday. The extension is 1189. But in Oklahoma City, the Oklahoma Insurance Department, they also operate a program that can help with this if you are not in the Tulsa area.
Okay, we get to move on to our additional viewer questions. And Dr. Williams, this one's for you. Do different Medicare options require a referral from my primary care doc to go to a specialist?
Good question. Actually, depends on the Medicare option. Those are important questions for the beneficiary to ask when comparing the different plan options before enrolling in a plan. A licensed agent can help them to understand and be a great benefit, and will be a great benefit in explaining these different options.
We have another viewer question. Scott, if you could take this one, what's the best way for me to protect my medical identity?
Yeah, that's really, really important. So first, treat your health plan ID card the way you treat your Social Security number. Keep it safe. If you're not going to need it when you're going out, leave it at home in a safe place so nobody can find that. Second, after you've been to the doctor, you will get from your insurance company an explanation of benefits. Always look at those explanation of benefits and make sure that it's something that you actually went into the doctor for, not someone impersonating you. And then finally, only share your health plan ID card number or other medical information with your healthcare providers. So with your doctor, with your hospital, or with your insurance company.
Okay, very good. Now we're going to go to Ty. What is coronavirus fraud and how do I avoid it?
Right, yeah. Scammers are offering COVID-19 tests to Medicare beneficiaries in exchange for personal details, including their Medicare information. However, the services are unapproved and they are illegitimate. Fraudsters are targeting beneficiaries in a number of different ways, including telemarketing calls, social media platforms, and even some door-to-door visits. Here are a few ways to kind of protect yourself from fraud related to the coronavirus. One, be cautious of unsolicited requests for your Medicare or Medicaid numbers. Be suspicious of any unexpected calls or visitors offering COVID-19 tests or supplies. Ignore offers and advertisements for COVID-19 testing or treatments on social media sites. A physician or other trusted healthcare provider should assess your condition and approve any request for COVID-19 testing. And if you suspect that COVID-19 fraud is being performed against you, contact the National Center for Disaster Fraud hotline at 1-866-720-5721 or disaster@leo.gov.
All right, well, thank you so much for joining us, and thank you all of us for tuning in. Thank you to our panelists. Many of you know we have additional questions covered here tonight. Many of you have these and we couldn't get to all of them, so we would encourage you to take advantage of the resources discussed this evening as you navigate Medicare for yourself or for loved ones.
And all of this information, as well as clips from this evening, can be found at news9.com and newson6.com. Thank you again to our panelists for the great information and our presenting sponsor, Global Health. Have a great evening and stay well.
Man, y'all rolled through that quick.
What time were we at?
Oh, I think we started at 5:19, so 30 minutes. We definitely, I would say, and Cynthia and Tracy and I will, and Mike will circle up a little bit. But while the panelists are here and our lovely hosts, what questions might you guys have for us? Obviously, we're going to do some rearranging. I've already rearranged those questions about the Medicare parts and also the terminology, moving that up to just after question number 3, and we'll get you guys updated scripts. Great call on that, Scott. Other questions or things that we could help with while we have the whole group together?
This is Michelle. One quick question. Have we already exchanged contact information in case we have technical difficulties the day of?
Yes, so Cynthia and I are going to work on that right after this call just to make sure. And then also we'll get some information out to everybody so that everyone is super clear on how to communicate about any issues or emergencies so that no confusion there. Eileen, your camera looks so great. I don't know if that was a window creating light behind you or if there was a light behind you, but it looks fantastic without that shine that was happening before. So
close the curtains.
Okay, perfect. If you can do that again in our next show, that would be great. And then also, Dr. Williams, if there would be a way for you to elevate your camera just a little bit, so that it's more straight on, that would be fantastic for the next show. You guys did a great job. I know Cynthia and Tracy and Mike might be able to speak to this a little bit more, and I'm going to ask them to chime in on this. One of the things that really goes over well with our viewers is anytime that you can add a personal story or an example. I know Eileen mentioned an example of a couple of people that have come in and had significant savings and even gave that number. I know there are privacy concerns or issues at times, but anytime that you can add a story with some of these answers, we've obviously got plenty of time for it. It helps people kind of relate to it a little bit. So anything that you can do to incorporate that, and if you need us to brainstorm ways that you could add that to different topics, let us know. But I always think that those nuggets go over well, and I know that viewers relate to it a lot. So any examples that you could add on any of the answers, since we do have the time, will help keep it light, especially when we're getting into some of the questions that are heavy on terminology. When we get to the other questions on how to navigate, or when you are working with someone, you're able to add that, it's helpful. Cynthia and Tracy and Mike, do you have any ideas on how they might be able to do that without breaking any, I don't want to break any confidentiality, but I do think that that's helpful.
I had a note that was similar. This is Tracy. Hi, everybody. Hey. I've been on mute. Just kind of in the line of work I do, I see a lot of X, Y, or Z. And I think that's a way to kind of, there's a way to bring your day-to-day life into this without saying there was a patient X, because I know that is something we can't do. I did have a note before we lose Dave and Bobby. I had something to share on that, is that when we're starting off, there's a lot of information we're covering, and a lot of it goes by really fast. And at the top of this, I think if we could maybe let viewers know there's going to be a lot of information. You might want to take some notes, but don't worry, because at the end of this, you're going to be able to go back and check it out, because otherwise I think we might see someone get overwhelmed and over informed and kind of check out on the audience side. So if there's a way to kind of mention that at the top, and I don't know which of you would do it, but that's something that I noted that might be difficult, because I think you can get overwhelmed quickly in that.
Yeah, I think we could.
Oh, go ahead.
Oh, Bobby, I was just going to say we could add that to the top and at the end of the show so that it's in both spots. And then I love the idea of, hey, grab a pen and pencil if you can, but if not, we'll have clips online and we can definitely incorporate that in the beginning and then also say it again at the end, Tracy. I think that's great.
Then I was going to say, this is Sam here. I know we had several questions that were probably similar, maybe even a little redundant. I think that's okay. Obviously, we don't want to answer the same question 10 times, but a little redundancy, I think, is okay on such a complex topic as Medicare. Just because, like you guys were saying, we don't want to overwhelm people, and we really want to hit home what we're trying to pass along on Medicare. So if a couple of questions are similar, I think that's okay.
And I even had in my note, it's okay to be a little redundant. I think as long as it's referential, I think we do well with that with an audience. You know, as Dr. Williams said, or as Scott was saying, and then it starts to feel more like a panel also. We're talking to each other on the panel like we would be if we were all seated on the stage together. So I think that comes across, that takes care of that a little bit too. But that way, if you want to expand on something they said, or if you just want to talk about it, you're still kind of that cross-referencing of what you're all talking about. I think you can pivot with those things. You don't have to go straight to the answer. You can pivot with a personal response that takes you into the answer that's natural to you.
It's Mike. I agree with that. I am gonna recommend though that we provide an alternative response for Dr. Williams to question 3. It was super repetitive as it was coming out. So we've drafted something that we can send over, Dr. Williams, for you to take a look at.
Thank you.
Mm-hmm.
And I just want to second what I think Elizabeth and Tracy both said. This is Cynthia. But I think anything you can bring in from your personal experience. Ty, I know you talk to beneficiaries and caretakers day in and day out, and Dr. Williams, you see them in the exam room day in and day out. And Scott, you know, I know you hear all of the stories with our members, and Eileen, you know, the same thing, helping all of the beneficiaries and their caretakers. I think the more examples that can just, I mean, without identifying someone specifically, really can help the beneficiaries relate, and I think can bring some additional context to this panel. So definitely, again, these questions are to help, you know, kind of guide the conversation, but interject any of those types of scenarios or examples you can, and I think it'll be even more relatable to our audience.
One thing I wanted to note about Eileen, I think she does a great job speaking to the viewer that we're talking to. She's not exactly just answering Dave or Bobby. She's saying, thanks, Dave or Bobby, for handing me the mic so I can talk to the viewer, is kind of what comes across in her. So when you're answering your questions as the panelist, remember that you're talking to the audience, who in the audience, and you can even have someone you picture that makes it easier for you to have that communication. You know, maybe there's someone that you just worked with today, Ty, that you can picture, you know, on the other side of that and how you would speak to them. I think that might be helpful to getting the patterns.
Now, if we get additional questions the night of the roundtable while it's going, are we planning to serve those up? What is everyone's comfort level and what is our approach to that?
I'll talk about anything.
Cynthia, I think that's really up to you and to the panel. There's ways that we can feed those into the chat. I think we just might need to know whether or not it's approved by someone for it to be answered. I know there were a few questions, you know what I'm saying? I know we went through some processes to make sure all of the questions were okay to answer. And I don't want to go down a road that you guys wouldn't be comfortable with.
Mm-hmm.
Was the plan that we were originally responding online to those?
Well, we have incorporated a lot of what has come in so far into this script. And so we can either answer those online after, or we can field them into the chat, and Cynthia could say, hey, these are approved, go ahead with these. And then we can also put all of them online eventually, if that's of interest, just in copy. But that could be something that we could talk about after the panelists hop off.
I think probably what I would like to know is, of the panelists, is there anyone that is not comfortable taking a question that we haven't kind of pre-canned? That way we already know everyone's comfort level. And then, I mean, Mike, jump in if you disagree, but I think if there's some questions and we have time that come in, that we can serve up in chat and we can quickly identify that, yes, this is a good one to cover. And knowing which panelists are comfortable taking those types of ad hoc questions, I'm all for it.
My only concern is we have a pretty broad level of experience across the panel. So even turfing those questions might be a challenge on the fly.
Okay. So then maybe what we do is just note additional questions that have come in. We'll respond at a later time, online.
Oh, I kind of hate to not try to answer people's questions. You guys know better than me. I just wouldn't be scared answering a question, or I would be willing to say it, we're not sure about that.
So what did we slot this for, an hour?
Yes.
And we skipped intros for the dry run, right? So where do you think we're gonna land?
So I would say, if you add some personal anecdotes to these questions, you do a little bit more back and forth, you're going to probably stretch another 10 minutes, add the introductions, that's probably another 5. So you're looking at 45 minutes. I don't think that is too short. We typically say anywhere between a half hour to an hour is a great length of time. Obviously saying don't go past an hour, that was kind of the max. But we want everyone to feel comfortable with the time length. Would you be okay with that, Mike?
Yeah. I just didn't know how long intros would take. And so I think that gets us within our, in the timeline. So we could open it up at the end for some live questions, but I would want Cynthia kind of real time being able to screen those.
Definitely. We can make that happen.
Perfect.
Yeah, I don't have problems answering questions as they come up. I think that's a good idea. I would hate to not do it. I agree with Scott.
Okay, so then let's plan for that. To the extent we have the time and we get some questions that Cynthia is comfortable turfing